Dr. Therian here, and if you're watching this video, it's likely that you just had a conversation with me about glaucoma during your eye examination. So understand that this short video is just to reiterate what we talked about during the eye exam, but it doesn't use to replace that eye exam or anything along those lines. And so glaucoma is when the pressure inside the eye is too high for that to handle, so it damages the weakest part of the eye, which is the optic nerve in the back of the eye. I like to think of the optic nerve as like a donut. You've got this yummy, tasty rim tissue, you got a hole in the middle that's basically worthless to us. So as the pressure goes up and comes down, it'll eat away at that hole, making it a little bit larger. So someone in America, normal demographics, about 30 to 40% of that nerve should be that hole in the middle. And so if it's larger than that, then we start to worry about glaucoma. We also start to worry about glaucoma if your pressure is outside the normal range. And normal range is 10 to 22, but you can be a little bit outside the normal range, and it doesn't always mean you have glaucoma, and you can be inside that normal range and actually have glaucoma as well. And so what we do every year is we'll take scans, we'll do dilated eye exams, we'll run visual fields, and we're looking to make sure that we're not losing any of that peripheral vision, your side vision, because glaucoma slowly kills off that side vision. It can mess with your central vision, but that's typically more in the later stages of glaucoma. So we'll run scans, we'll look at that optic nerve, and we'll gauge where it's at from year to year to year and make sure nothing's really changing there. So the way we can treat glaucoma though is with a couple of different options. One is we can do laser surgery as well. We can do like SLTs, ALTs, peripheral iridotomies. There's a few different laser surgeries that we can do to try to get it done. Now, if I had glaucoma, I would go have a laser surgery done like an SLT because I do like it and I think it's a better procedure overall. Now, having said that, most of my patients are on eye drops. That's kind of the normal treatment that we've always done for a long time. And so we put them on an eye drop and they do it maybe once a day, maybe twice a day. But there's lots of options there from an eye drop standpoint to get those pressures pulled down. And so every 6 months or so, 3 months, 6 months, we'll drag you back in, we'll run visual fields, we'll take a look at that optic nerve, evaluate and make sure that everything's holding steady. We'll look at those pressures, make sure something's not happening there, nothing's changing with your eye pressure. And if we start to see anything that gets us nervous, we can adjust the medications, adjust the treatment to get things fixed up. And so understand that this video doesn't replace the need for an eye exam. It's just there to reinforce what we discussed. And if you have any further questions, we're always here to help.